Hey everyone, it's Michael here at Home Health Success Academy, and you are watching our home health fraud video series where we share with you guys information about how a lot of people have got caught and also are still committing home health fraud. So, okay, in this particular video, we're going to talk about what we call independent marketers and how independent marketers can actually, cause you guys some legal problems. So, in our industry, we have people that, have been working either as a nurse, as a previous marketer, and what they do is they go from home health to home health. And what they're saying is that, hey, I want to work as an independent marketer for your company, and I can get you a stream of patients that I have under my belt that I know that I can make sure that we can get orders to be able to be referred to your agency. And so these marketers, let's say marketers, or let's first start with the marketers, right? So it means that they've been marketing in this industry already, and they have a name or a book of names of patients that have received home health services. Now, they can either know these patients directly now because they've worked with them, or they just for some reason got a list of these names of patients who've had home health services. So as a home health company like yourself, if you're an administrator, if you're a DON, or if you're like, let's say for example, a marketer, and you got approached by an independent marketer saying, hey, let me help you get more patients. The first question you must ask is that why do you have a book of patients? Because first of all, for us to be able to properly admit a patient in the home health industry, a physician has to refer these patients to us first. Not find a patient, need services, then find a physician for them. Okay, because that's one thing that can cause problems for you. So a lot of these independent marketers, as we may say, has probably been a nurse, for example, and she's worked with patients under a different agency, and the patient has a relationship with her or him and has trust. And so they would probably want to go see that nurse. They want that nurse to take care of them. So whatever agency this nurse works in at that time, or wherever he or she works now, is where they're going to follow. And so that's the last thing we want to be able to do, is working with these type of independent marketers. Now, there's independent marketers out there who even created their own company, an LLC or an S corp or whatever it is, to try to put some legitimacy into what they do. But that is still how we should not act upon. We should not work with these independent marketers, as they may say, because it can actually cross the line and can cause problems for us. And sometimes you will see these independent marketers will say, okay, fine, I'll bring these patients in, but when they need therapy, if they're a therapist, I want to be the one who provides therapy for them, and I want you to pay me for that visit. Or if I'm a nurse, I want to be the nurse that visits this patient. So they want to get paid for a referral fee for bringing that patient in. That's number one. And they also want to get paid for the services needed for these particular patients. And so they're trying to make or maximize their income from these particular patients. And we definitely need to be able to start seeing that there's a problem here that we should not actually put ourselves into. Remember, a lot of people are doing and committing fraud in our industry because they're trying to shortcut the game, because they actually rather pay that $500, that $750, for that referral, rather than invest the money into a good marketing strategy, bringing in the right people to be able to increase that. And the funny thing is, these marketers, these independent marketers, what they do is they may have, let's say, a list of 20 patients, and when you're done with your 60 days, if the patient is not being able to be readmitted because we just find out that, the patient is chronic, we can't really continue the services, they don't need additional home health services, so your company discharges that, well, that independent marketer will then take that group of patients and bring them to another unsuspecting agency, or another agency that doesn't mind doing what that marketer is trying to do. So you as a company must stay away from these independent marketers. How do you recognize them? Is if they say, I have a group of patients that I can bring to you. Rather than saying, I have a physician, okay, that I have connections with, and if I work with you, we can definitely get patients to come to your agency. So, that's one thing how we can actually spot these type of fraudsters. Another thing is this: to avoid getting these fraudsters, we ourselves should create our own marketing plan, our own marketing strategies, provide education for our own marketers, our own sales team, to be able to create new referral sources and take care of them so that they can keep on referring patients to us. So I hope this video kind of clarifies a little bit about why you should stay away from independent marketers. And if you have any other questions, please comment, give us a call. This is Michael with Home Health Success Academy. Stop by, see us at 10xpatientreferrals.com. Hope this video helped you guys. Always remember that home health marketing is easy when you know what you're doing.